Bernese Mountain Dog hip dysplasia, prevention and treatment. Hip dysplasia is a common condition that affects many dog breeds, including the Bernese Mountain Dog. As responsible dog owners, it is important to understand the causes, symptoms, and treatment options for this condition in order to provide the best care for our furry friends. Hip dysplasia occurs when the hip joint does not develop properly, leading to the femur bone not fitting correctly into the hip socket. This can cause pain, lameness, and eventually lead to arthritis. While genetics play a significant role in the development of hip dysplasia, there are also environmental factors that can contribute to its occurrence. To prevent hip dysplasia in Bernese Mountain Dogs, it is essential to choose a reputable breeder who conducts hip screenings on their breeding stock. The Orthopedic Foundation for Animals, OFA, and PenHip are organizations that certify breeders who have screened their dogs for hip dysplasia. These screenings involve X-rays of the dog's hips, which are then evaluated by experts to determine the presence and severity of hip dysplasia. Aside from genetics, certain environmental factors can also affect the development of hip dysplasia. Overfeeding, rapid weight gain, and excessive exercise in a growing puppy can put extra stress on the developing joints, increasing the risk of hip dysplasia. It is important to provide a balanced diet and avoid overfeeding to maintain a healthy weight for your Bernese Mountain Dog. Regular exercise is crucial for a Bernese Mountain Dog's overall health and well-being. However, it is important to strike a balance between exercise and rest, especially in growing puppies. Exercise should be low impact and non-strenuous, such as swimming or short walks, to minimize stress on the hip joints. If a Bernese Mountain Dog is diagnosed with hip dysplasia, there are several treatment options available. The most common form of treatment is weight management and physical therapy. Keeping the dog at a healthy weight reduces the strain on the hip joints and can help alleviate some of the symptoms associated with hip dysplasia. Physical therapy, such as hydrotherapy or gentle stretching exercises, can also help improve muscle tone and joint function. In more severe cases, surgical intervention may be necessary. There are several surgical options available, including total hip replacement and femoral head ostectomy. Total hip replacement involves replacing the entire hip joint with an artificial joint, while femoral head ostectomy involves removing the femoral head to eliminate the bone-on-bone contact in the hip joint. These surgeries can greatly improve the dog's quality of life and reduce pain and discomfort. In addition to medical treatment, there are also alternative therapies that can be beneficial for dogs with hip dysplasia. Acupuncture, chiropractic care, and massage therapy can help alleviate pain and improve overall mobility. It is important to consult with a veterinarian or a certified professional in these fields to determine the most appropriate treatment options for your Bernese Mountain Dog. In conclusion, hip dysplasia is a common condition that affects Bernese Mountain Dogs and many other dog breeds. By being proactive in preventing hip dysplasia through responsible breeding practices and providing appropriate care, we can help ensure the well-being and quality of life for our beloved pets. Regular screenings, weight management, and low-impact exercise are key to preventing and managing hip dysplasia. In more severe cases, surgical intervention and alternative therapies can provide additional relief. By taking these steps, we can help our Bernese Mountain Dogs live happy, pain-free lives.